Chisasibi Hospital is the regional hospital for the James Bay Cree Territory. There are 9 communities. The hospital will take transfers of patients from the 9 communities for simple things. If it's something where we don't have the resources, then the people get transferred south. The medical team we have here is all family physicians. There are no specialists on territory. Normally, we staff the place with 8 family physicians because we have both the emergency room to run as well as we have the medical ward. And then there's also all the outpatient clinics. We have what's called a WASH, which is prenatals and baby care, pediatrics. We have the CHIOs, which is where you see any sort of chronic care like diabetes, hypertension, hyperthyroids. And then we have USHI, which tends to be the adolescents to the about 25. So you really get a taste of everything. With the North, in many ways, it's like working in a different country. You have here on the Cree Territory a population that has a very different history. You have just the hunting-gathering perspective of life, and you really get to practice listening to a person and really trying to understand their perspective. And that's something here we actually help the students with to be able to overcome that hurdle of how to do, if I can say, cross-cultural communication. The nurses here are incredible. Oh my gosh, they're the lifeblood of the place. That without them, it would be impossible to function.
Amy Nisangason. I'm the team leader nurse here at the Emerge, and I've been here for 17 years. Here up north, we're a really small team. I would have to say that it's a really dynamic team. Here, our collaboration with the doctors is really good, and we get to know each other really well because we work together so often. To be better prepared, I would say familiarize yourselves with the history of the Indigenous people, especially Canada, and the history that we did not learn in history books.
Thank you. The biggest challenge of practicing medicine in the North in general is when you have a situation that things are going sour and you know in your head, oh, if I were sitting at the Glen, we could do X, Y, Z and problem would be solved. Whereas here you're thinking, okay, how am I going to help keep this person alive till that medical plane can come get them and bring them to the general? I think that would be the hardest part. In terms of working here, one of the benefits is how we're able to interact with our patients. If you need the time to talk with someone, here you can take the time. You don't have to feel rushed because you've got everyone else in the Emerge waiting. Like, patients are treated the way they need to be treated.